Have you ever wondered why some children close their eyes in certain situations? Perhaps it's during a specific task, in the presence of certain individuals, or when introduced to certain environments. It's a curious behavior, one that might leave parents, caregivers, and even therapists scratching their heads. But don't worry, there's a method to the madness, a way to understand and address this behavior. The first step, as always, is to conduct a thorough assessment. Observe the child in various settings and situations, noting when they close their eyes and the specific circumstances surrounding the event. Look for patterns, consistency, and any triggers that may precipitate the behavior. Next, it's essential to identify what events or situations precede the behavior. Is it triggered by specific tasks, people, or sensory input? It's also important to observe how others react when the child closes their eyes. Are they given attention, or do they escape from a task? The child's environment also plays a vital role. Evaluate the child's environment for potential sensory triggers. Is there excessive noise, bright lights, or strong odors? Assess the physical layout of the space and determine if it's well organized and structured. Investigate the child's communication abilities as well. Are they using eye closing as an alternative method to express their needs or preferences? Once an understanding of the behavior is established, the intervention process can begin. Create a structured and consistent environment that minimizes sensory overload. Implement positive reinforcement by providing rewards or praise when the child keeps their eyes open during appropriate times. Use visual supports like social stories, visual schedules, and task analysis to help the child understand when and where closing their eyes is inappropriate. And if closing the eyes is due to sensory sensitivities, gradually expose the child to sensory experiences they are uncomfortable with, helping them adapt over time. Work closely with an occupational therapist to address any sensory issues and provide sensory integration therapy. Educate parents or caregivers on these strategies so they can reinforce the same behaviors at home. And of course, continuously monitor and collect data on the child's behavior to track progress and adjust your intervention as needed. If progress is slow, or if there are complex underlying issues, don't hesitate to consult with other professionals, like a psychologist or speech therapist, to address any related challenges. To wrap things up, every child is unique, and it's essential to tailor your approach to the specific needs and circumstances of the child in your care. Remember, understanding is the first step to intervention. And with patience, consistency, and the right strategies, you can help guide the child towards more adaptive behaviors.